Hello everyone, this is your first time seeing me on this channel, and until today you saw like my other projects about Arduino and like how to do things. And first let me introduce who I am. My name is Ruchira and I'm a software developer. So today I'm going to show you an interesting project. This project is about medical field, and for those who know me know that I'm interested in the medical field and the IT field, and for some reason I decide to stay in IT field. So what this project is about: so people every day face issues regarding to the medical field, especially like adults and even young adults, because sometimes doctors don't know what's going on with your health because we don't have like a medical record. I remember that when I was a child I had a medical record, like it's not even like a medical record, but it was something related to the vaccines, the record of vaccines. So I thought, why shouldn't I create something that looks like that? Because since we don't have like these records, it's very hard to predict what a patient is going through, because if you are a doctor you know how hard it is to understand what's going on and if this patient is telling the truth or not, because sometimes patients are not telling lies on purpose, but they are doing it because they are confused or they don't know what's going on. So to prevent all these misleading and issues, I decided why shouldn't I create a project, because this is my actually a university project done in second semester. Teachers gave us full permission to, like, we had all the freedom in the world to select a project, so that's a good thing. Indeed, like they told, like if you are going to select something that you don't like, you will give up for some point because you don't know like how to develop it. So I came up with this thing because I'm interested in the medical field and IT, and I like to solve problems. Yeah, I like to solve problems and puzzles. So what this project is about, as I already gave you some tips, issues what people are facing with doctors and doctors with patients, I came up with this little project where, like, we know that every patient, every single person in a country has a social security number. What is social security number for, if there is somebody who don't know who yeah. So a social security number is also considered as a tax number. It's the code that you get when you register yourself at the in your country. It's like an identity card, but this code can be modified, but only in some point. For example, if you change your name, or for like very very important reasons. So yeah, and this social security number is used to identify who you are. That's what technically it is. In some countries it's a document, and in some other countries it's not. That's why we have an identity card. Okay, so since everybody has a social security number, I created, suppose that I'm the government, so I want to keep my people safe. So I have this, I know that there are some websites in some countries related to their like these things, like FAD. So I made this website. I didn't launch it because it's obviously it's a university project, but we can apply it to the real world. And I hope that somebody who is watching this video, or you have like friends, or you will help me to deploy this project to the world, because I believe that this can simplify the whole system in the world. All the complex, I mean, it will be complex for software engineers to program it, and of course also for the security teams, but it will ease all the issues related to the not the medical field, because when we are talking about the medical field, we are speaking about all the medicines and how to make medicines, but no, we are just speaking about the relationship between hospitals, doctors, private doctors, and patients. That's it. So how to solve this? I can while I'm talking, I can show you what I'm thinking and how it's supposed to work. So imagine, first thing first, you get a social security number. One thing is, like, a social security number is given to you when you are, in some countries it's like 18 years old, but sometimes you get like at a very early age. So in this case, suppose that you get this social security number at once you are born, so you get it pretty fast and pretty soon. So we know what's going on and all the vaccines and stuff. So if you are a kid, your parent will register you on this website. This is the home page, where of course you can see like the basic phone numbers, email address to contact. Of course on Facebook, Twitter, we don't have Twitter anymore, but it's fine. We have the logo. Why Rumen? Because my name is Richard and Med is for medical faculty and medical stuff. So who knows, one day if I can open a company related to it. So yeah, this is the home page where we can search for doctors, about an FAQ, and we can obviously log in. And yeah, this is a very basic web app where we can register ourselves or even our children. I mean, the most important thing is, like, when we are born, when we are born, we get an social security number, and with that, of course, at the early age we cannot register ourselves, so our parents can do it for us, so we can register like which type of vaccines we got and everything until we are like 18 years old or even older. So yeah, this is a very basic home page where as you can see. So yeah, this is my school project actually, and our teachers didn't care that much about the presentation there, and yeah, all they care was like if we had like interfaces, classes, like the software things, because yeah, we are studying here about software, right? So yeah, it has but I wanted to make it a little bit noisy because because the presentation is important, because people must understand where to click. And for understanding this website is like, of course, I have the registration button, login, and of course emergency, medical, and appointment. In emergency, we can also click on like I got burned, for example. I got burned, what should I do now? And I got a cut, what should I do? Because there are so many blogs and websites where mislead patients, and when they reach to the hospital, the cut is like worst, or there are so many bacteria due to what they did. And in the medical history, they can click on the check my report, and it will redirect to their profile, and they can check their medical history. And same thing for appointment. You can get an appointment with the doctor. And yeah, as I mentioned earlier, this whole project is mainly focus on private doctors, also somehow also for like hospital doctors, because they have like access to the medical history, because it's very important to important that they know what's going on, where you have been, what type of illness or disease you have. So for this reason, yeah, this is a very basic and simple design. Indeed, we can improve it a lot. And yeah, as a normal website, it has all these things. And yeah, so first thing first, register a new user. So the parent will register their baby, so they can call like Summer, aircon, date of birth is I don't know, 27/06/24, gender is male. Of course we can select the date like this as well. And telephone number is 0 1 2 3 4 5 6 7 8 9 10. Of course, if the number is more than actual, it will get a message like telephone number must start with the plus sign and followed by 11 and 14 digits. So let's delete this. And SSN numbers 1 2 3 4 5 6 7 8 9 10. So here as well, SSN must be exactly 9 digits. So yeah, let's keep it like this, and let's save our information right here, because we will need later these credentials to log in. And the name is Summer. So so the email address is summer@gmail.com. Home address via Summer, certified 25 Amsterdam. Role, so we have like 3 roles, mainly 3 roles, and they are like a doctor's, patient, and administrator. So the doctor is essentially the one who prescribe and see the medical history, and the patient is the one who see the medical history, and he is not supposed to remove or modify anything, because we have those patients who would like to change something. So we don't want to do that, we won't let them do that. And also we have like administrator, where who is supposed to take care of all the appointments and bills. So according to that, of course, if selected as a doctor, we have to insert the job ID once you get the permission to work, right? And the specialization. So at the moment I put just these things and the password. And if it's the administrator, of course, he has to insert the administrator job ID. And if it's a patient, it's very easy. You can just insert the password, that's it. Because once you create the profile, you can edit your own profile. So yeah, I forgot to mention, then if we don't insert like these fields, we automatically get these messages like these fields are required. And so yeah, let's put them back. Summer@gmail.com, and this one is this password. I want to be Summer's register. So we are now registered, and we can log in as the patient now. So how does the login page works? Because if a login page is we can recognize who the user is. If it's just a number, it means usually a patient. And if the ID start with the D, it means like a doctor, and if the ID starts with the NA, it means usually an administrator. So the program actually can understand who the user is. So let's log in as the patient, and this is the patient dashboard. Of course, the patient can see medical history, prescribed medication, surgeries, vaccines, allergies, and schedule appointments, tips, and emergency. I will talk about this later. And so yeah, we have also the personal information like the first name, last name, date of birth, gender, and the patient is patient can modify all this data through edit profile and change password. And patient profile, they can edit their profile, and so if we take a dashboard, we go back and see pretty much everything. So what the doctors and administrator dashboard works the same way, but the only difference is that instead of having emergency contact and patient contact, doctors have like the clinic address, because they can change it, right? But in the case of the patient, they can fill emergency contact, like who should I contact in case of an emergency, because we know that unfortunately there are some occasions that might happen, right? So for this reason, we have like all this emergency contact where doctors can see who the emergency contact is, and also a parent contact. So in case of registering a child, we can the parent can fill this area. Of course, I'm not going to edit all this stuff because it will take some time. Dashboard. So yeah, medical history is essentially where the user is going to see the medical history, or the patient can see the prescribed medication like surgeries, vaccines. So we can fill all this data, and like what type of allergies we have, so the doctors can filter all the medicines based on the allergies. So the doctors already know what's going on with this patient and schedule an appointment. And we can log out, and so I can show you what the doctor's profile looks like. It's the same thing. So instead of other buttons, we have like find patients, prescribe medications, medication appointment, and emergency. So same thing, we have clinic information, and we can edit the profile easy. So coming back to the patient dashboard, we can go to the medical history. So in this case, this patient has 2 records, both like medical general visits. So how this essentially works? So a patient can see the visit date, or like even doctors can see like when did this patient visit the other doctors, the visit type, general visit, or the doctor name who prescribed this medication, like the symptoms, dying, or like the headache diagnosis, migraine, prescribed medicines, or like the medical notes, like twice a day. This is very essential and fundamental that we don't even think about, because like once we have all this information, it becomes very easy to treat things. Because like, for example, my father sometimes doesn't even remember like when to take some pills. So we are like, what should you do now? Go to visit like the doctors. But what if you are working, you have to get leave? And so instead of doing all these big things, we can simply read these kind of information on our web app. So it's very useful. And of course, we can also see like a general note, like come after 2 weeks, redo the test after 6 months. So they are very nice. And of course, I cannot like so if we write like, if we want to filter like all the records for a year, we can do it like 2024. Unfortunately, I don't have like any records for like how to say, like for for past years. But if we take like for like, we can filter also the visit type, doctor name, symptoms and diagnosis. So for example, asthma, filter, you see we can filter all these, so the doctors can see like what type of symptoms this patient had. So it becomes very very easy to understand and treat a patient, and it's very efficient. Yeah, it becomes very efficient when it comes to the medical field. So now let's speak about the desktop app, what it's supposed to do. Same as before, let's log in as, now this time let's log in as a doctor. Login, give it some time. And so yeah, here we can see the doctor name, welcome Dr. Dash Bumble, the doctor dashboard. And so this is very basic, very very basic. We didn't even thought about like the presentation, because we wanted to make this happen, make like show what this project is supposed to do and how it's efficient for the world and how practical this is to the world. So yeah, search a patient. We can search a patient. Of course, once the patient comes to us, we must know, they must show us their SSN. So this, okay, and of course we can see like the patient name. In this case, once we write the SSN, we know that this is this patient, so already just said that. But if we write like another one, we know that this is the Rukira, so we can take this patient. So usually this project is also taught about the security, so that's why they can give you like an access code, and once we get this access code from our patient, we can access. But to ease this time, I don't have any access code, so I can directly click on access. But since we are speaking about the medical field, so it's very essential to secure about this kind of stuff, because imagine like if somebody has somebody else social security number, they can see all the medical history and prescribe, even like falsificate all the things. So we don't want to do that, so that's why we need a security code. But in this case, this is like a demo, so it's fine. So yeah, if we want to develop this project even further, we can leave it. So prescribe, this is the window that doctor gets. So visit date, we can fill the visit date like 27, 26, 24, or even before we prescribe something, a doctor wants to see what this patient has done. So to do that, give me a second. Yeah, so we can see all the visit dates, like this patient went to see a doctor in the month of 2024, 5, 10, 7, 17. Visit type, I check after I just, yeah, all these things, and doctor name. Yeah, we can see like who prescribed these things. For example, in this case, Valeria Van Beek, and in this case, there's a flow. Yeah, and symptoms this patient had, diagnosed, prescribed medicines. So it's very very useful, because we can get an idea of the patient. So this is why it is important, because sometimes we don't, like as a doctor, we don't know like what's going on the head of the patient. Sometimes they feel this, sometimes they feel like that, and we don't know what to treat. So that's why sometimes doctors give simply a like a pill for the headache. So yeah, to avoid these things, now we have like the medical history. They can see it, and then they can treat all these little things. So let's go back to the prescribe now. So we are here in the prescription page. We can 27, 26, 24 symptoms. I don't know, symptoms, recording date, diagnosis, can be recording, prescribed medicines. Of course, I cannot prescribe anything like this. Indeed, I cannot even type anything here because I can select it directly from this window here. It's done on purpose. I will tell you why in a bit. Like medication note, take this pill twice a day. A general note, come after this recording. So we can, so here we have like some basic pills and medication, right? So for example, I don't know, like I cannot find a pill, so I would go for the name. So you see, it's already filtered, and we can add it to the list, or we can remove it from the list. And of course, we can also we can filter for the company name. So here we have like two, because like TAM is referring to the acetaminophen and the tamsulosin, so that's why it's filtered. But we can also filter it by the company name, like Johnson. So you see, right after we write the name, it's there, and we can add to the list, and we can complete the process. But what if we want to do something different now? For example, I want to prescribe this patient several medications, like acetaminophen and metformin. So all the medications, you can see that up there. So yeah, we can complete it. So record added successfully with ID. You see, it's very easy. It's very easy. This is what we need into 2024. And when we go to like a view medical record history now, we can see the record 27 dash who assigned, who made this prescription, Bumblebee, on this date, recording day, recording. We can see all these things, right? So we wanted to take this pill twice a day, and let me the general note is come after this recording. So yeah, that's it. And I think it's very efficient for a patient doctor relationship, because it gives all the necessary information. So yeah, we can also go for appointments. It's not developed yet, so I cannot show it yet, but like medicines, as like if a doctor doesn't have any patients, they can check like new medications, they can filter stuff like so yeah, a live filter. So that's how it's supposed to work. I hope you understood how this project works, and we can of course log out. So yeah, so I'm not going to annoy you with all the code, because it's really a lot of work beside from what I showed you. It's like a work of 3 months. Of course, I can did it like within 1 or 2 months, but this is how this program works. So at the beginning we had to write all the project and documents, and it made the work easier because we had like an initial plan, or how it's supposed to work. So I hope you got an idea of what this project is about and how important to have something like this in 2024, because I'm pretty sure that everybody gets sick, everybody get a disease at some point of their life, and especially if you have like a parent which get sick or has a disease, it becomes really annoying to track their medical history, because sometimes it's not the thing that they are saying. So what the doctor is saying, they are modifying it slightly. But if you have like a 60-70 years old parent, you can track your parent medical history and you can get an idea of it. But more than that, the importance of this project, this program, is focused on simplify the relationship between doctors and patient, because as I already mentioned earlier, sometimes it becomes very annoying because doctors don't know or they don't remember who you are and what type of diseases you have. So to avoid all these mistakes and misleadings, this project is very useful. Indeed, I may from where I did get this idea, because as I was living in Italy, like I was always thinking about like why there is not such a system to show patients like these kind of information to doctors, why they can have all this information. Because for example, if you are going to a surgery, it's essential to have all this information, but for some reason still in 2024 we don't have this kind of we have the technology, but for some reason we don't have some platforms, or in government we don't have something like this. So I invite to adapt something like this, because we have to think about the patients, we have to think about the relationship between patient and doctors, we have to ease it, because not always things are roses. Not everything is like butter. So we have to, like, if there are so many software engineers, why can't we develop something like this? I can give you the idea, and if you would like to, like, for your government, for your country to develop something like this, I will obviously help you. And this is the whole point of this video, because I know that many governments are having difficulties managing the medical field, the relationship between doctors, especially like if you go like the Netherlands, people know how they are having a hard time going to doctors, and even they go to doctors, they cannot get the pill that they wanted. You know what I mean? It's not the doctor's fault, because they are obviously afraid of giving something that is not related. Now you will say, then why are they studying for? So the thing is, like, the doctors actually don't know if you are trying to say the truth or not, because the world we are living is strange. Even like my father, when he goes to like doctor, he says like the pain is in my head, but the actual pain is in his eyes, because it's connected to the head. So like a simple nerve can cause a damage and mislead the treatment. So this is what I'm trying to say. But if we have all these technologies and ideas, we can improve the society, and we, instead of using them to to useless things, we can make this happen. Because as a recap, think about like there is a baby, and the baby is born, and the parent want to register this baby to the system, so the system know like what type of diseases, sickness this baby had, or the vaccines or the allergy, because the parent can insert these kind of information to the system. So the doctors going to see the doctor, they know what type of vaccines, allergies this baby has. So what should I prescribe to this baby to avoid serious damage to the baby? This is exactly what we need. And to avoid speak about like the authorization, we can make a system to give a validation code, because we know how important the security is when it comes to the medical field. And so yeah, a doctor can see the medical history, what's going on, what this patient had for the past years. And so after reading all that records, he can come to a conclusion, okay, maybe this patient has gastritis because I prescribed these milligrams of medication. So maybe that's why the reason, maybe that's why he's having an heart disease. Indeed, one of the branch of this project was to give an alert to the patient, because sometimes a doctor unknowingly prescribe medications of more than 100 milligrams, and there is a chance of getting a gastritis. And getting a gastritis, it's not a nice thing, because the symptoms can be like a stomachache, but it's not a stomachache, but it hurts really here. And we don't want to mislead, and we don't want to treat something that you don't have and make it worse. You know what I'm saying. So this is why this program is important. So if you are watching this video, and if you're a software engineer, and if you are somebody who is taking care of the government, or if you are working in the government, and yeah, I hope you get the point of this video. And that's pretty much it. And I hope you like the project. And yeah, let me know what you think about this whole project in comment section. And I'm very happy to answer you and help you. And if you think we can develop something like this, I have all the documentations done, and I can share them with you. And yeah, so have a nice day. Thank you for watching.